Hi, welcome to our video on liquid biopsy. A liquid biopsy is a non-invasive test that can detect cancer cells in a patient's blood, providing a way to monitor the disease and track its progression. In this video, we'll be answering some of the most frequently asked questions about liquid biopsy. First, let's talk about what a liquid biopsy is. A liquid biopsy is a non-invasive test that can detect cancer cells in a patient's blood. Unlike a traditional biopsy, which involves taking a sample of tissue from the body, a liquid biopsy is performed by analyzing a sample of blood. A liquid biopsy typically works by analyzing DNA in the blood sample. Cancer cells often release small fragments of DNA into the bloodstream, which can be detected using a liquid biopsy test. A liquid biopsy can detect a variety of types of cancer, such as lung, breast, and colorectal cancer. However, it is currently most commonly used to detect and monitor certain types of blood cancer, such as leukemia and lymphoma. A liquid biopsy is a simple and non-invasive test that can be performed in a doctor's office or a lab. A small sample of blood is taken from the patient and then analyzed for the presence of cancer cells. A liquid biopsy has several benefits over traditional biopsy methods. It is non-invasive, which means that it does not require any surgical procedures or sedation. It is also less painful and has a lower risk of complications. Additionally, it can be repeated as often as needed to monitor the progression of the disease and track the effectiveness of treatment. However, liquid biopsy is not intended to replace traditional biopsy methods. It is a complementary test that can provide additional information about the presence and progression of cancer. A liquid biopsy is typically used in conjunction with other diagnostic tests, such as imaging scans and traditional biopsies, to provide a more complete picture of the disease. It's important to note that liquid biopsy tests are still new technology and are constantly being improved. The accuracy of a liquid biopsy can vary depending on the type and stage of cancer, as well as the specific liquid biopsy test used. A liquid biopsy may be recommended for patients with certain types of cancer, such as blood cancers, as well as for patients who have already been diagnosed with cancer and are being monitored for disease progression or treatment response. If you or a loved one has been diagnosed with cancer, it's important to consult with your oncologist to understand if a liquid biopsy is a suitable option for you.